Kahangala has put it the way it's supposed to be. But to add, the 136 infants are from Kiambu Level 5 and Thika Level 5. Those are only 2 constituencies in Kiambu County where we have 12 constituencies. We are not talking about the other 10 constituencies. It means the number will be higher. If we add the other hospitals, the number will go higher. It means the blood of our children and those of our mothers, it is on the hands of Governor Wamatangi. This is pure massacre, where children are dying and the county government is doing nothing about it. If you go to those hospitals, even if you visit the 4th estate, you visit those hospitals right now, they are in a pathetic state. Actually, the hospitals of Kiambu County are in ICU. All of them. The hospitals themselves are sick. There are no medicine. There are no doctors. The cleaners are not there. The facilities are in a mess. Not only even in the hospitals, even if you go to the morgues, the stench is coming from far and wide. The estates next to those morgues, we are talking about the health sector in Kiambu County has truly failed. And we saw the other day in Gatundu North, where a father was taking the child to the hospital. And when he arrived at the hospital in Gatundu North, there was Igegania. There was even nobody to receive the father and the child. So the child died when the father was holding the child in his arm. And he was trying to call, who will receive my child? There was nobody. If you go to Kiambu hospitals, and they are national hospitals, they are referral hospitals, they close at night. Have you ever had hospitals that they close at night? And I can see the mothers from the 4th estates, where if you know, for some reason, children always become sick at night. So if these hospitals are not operational at night, then who are they serving? And to be very honest, the interns who have been retrieved back to the national government, the interns come to be attached to the doctors, and the doctors are not operating. So what, in fact, those 3 months, what were those interns doing in Kiambu County? Because if at all you are supposed to be attached to a doctor so that you can see how medication or how treatment is offered, and there are no doctors, there was no even need for those interns to be in Kiambu County in the first place. The doctors have tried to talk to the county government, to no response. What the governor does is PR. He doesn't want to meet the doctors and raise the issues that have been raised today here by the members of parliament. What we are telling you, the members of 4th estate, just visit Kiambu County. Whichever hospital you pick at a random, those hospitals are dead. If not ICU, the facilities are dead. And that's why you can see in 2 hospitals, only referral hospitals, Kiambu and in Thika, 136 infants are dead. If you add the other constituencies, the number even will reach 500, meaning there are so many people who are mourning in our county because of negligence of the county government. So many people mourning. If you go to KU referral, or if you go to Kenyatta National Hospital, or Murang'a hospitals, the Kiambu people have opted to go to those counties for health care. And if you realize, years earlier, people would move from other counties, even northeasterns, or even Machakos and Murang'a to come to be treated in Kiambu County. This time, vice versa. Wamatangi has really killed our health facilities in Kiambu County. He is murdering our children, and we are watching, and we have said enough is enough. As members of parliament, we will not sit back and watch Wamatangi wasting our health facilities. Thank you very much. You know, I also want to say I chair the Social Protection Committee here at the National Assembly, where we oversight matters to do with children. Those are children that have died in Kiambu County. And like the way we oversight the other county, other region of the country, Kiambu is still part of Kenya. And these children have died in Kiambu County. And we cannot we mute ourselves or we stay mum, and we know that we are really suffering. And I really want to tell you people of all the state, for sure, just visit Kiambu County at a random. You just go there and see exactly what is happening. They might try to do a lot of PR because the doctors have come out clearly to say that they have not been going to work for 127 days. We have seen so many dead parents crying from Kiambu County, and the governor keep on saying that it is politics. Some of the lives of people can never be politics. Bottom line, 136 infants have died in Kiambu County, and those are only 2 hospitals. You have heard there are other 10 hospitals that have not been included. So if you include those other 10 constituencies, it will raise this number from 136 to 500, meaning many homes are mourning. And if you don't do something right now, and I'm saying if Kiambu County government cannot be able to handle the function of health, the national government is there. The national government can step in and take care of those hospitals, because those hospitals have been in existence for so many years. And now this is the only time. Kabogo's time, hospitals were doing very well. Wetito's time, hospitals were doing very well. Even Nyoro's time, hospitals were doing very well. This is the only time in Kiambu County that we have had crisis. And right now I can tell you, the county, instead of county government accepting that something is wrong, they keep on saying it is politics. Where people have died, they keep on saying it is politics. Watu either hata hao wenyewe sio hospitali gonjwa, hata hao watu ambao wanafanya na county government pia hao ni wagonjwa. In fact, they are very sick themselves. If 136 people can die and you don't even come to say you are sorry and say you are going to improve on your facilities, you keep on denying, it means pia hao ni wagonjwa. Ni wagonjwa. Kutoka governor kuingia kwa masisi wake, wote ni wagonjwa. Wote ni wagonjwa, na ndio wajaona kuna janga. There is a crisis in Kiambu County that need to be addressed.
So mheshimiwa, kama ukimalizia tu hapa. Kuna sababu mbona nauliza hili swali. Kwa hiyo tangu hii program ilipozinduliwa mwaka 2023 ya Kiambu Afya, unaweza kusema hakuna faida yote ambayo imeleta.
Tuseme hiyo Kiambu Afya sasa, tukisema maneno ya Kiambu Afya, akiwa madaktari hakuna, akiwa wamama wanafungiwa miezi 3 kwa sababu hakuna madaktari na wanakataa. Tumeona juzi wamama wamekaa Thika level 5 for 3 months, watoto walizaliwa mpaka wakapata meno bado wakiwa kwa hospitali, wamefungiwa na hakuna mtu wa kuwafungulia. Akiwa ilikuwa inafanya kazi, tungekuwa hapa. Mahospitali ya Kiambu County iko kwa state ya ICU. Tumeona watoto wetu wa Thika level 5 na Kiambu level 5, watoto wale wamepoteza maisha yao ni watoto 136. Na tunataka kusema hizo ni hospitali mbili tu Kiambu County. Kiambu County tuko na constituency 12. Na tunataka kusema hata wamama, juzi tumeona huko Igegania, baba amepeleka mtoto hospitali na amemshika hivyo na anajaribu kuitana afunguliwe kwa mlango kwa sababu mtoto wake alikuwa kwa critical condition, hakuna mtu aliwa-receive. Kwa hivyo huyo mtoto aliaga akiwa mkononi mwa baba yake. Tuko hapa kusema ya kwamba hospitali za Kiambu County zimeisha na zimekufa. Akiwa ziko ICU ni gonjwa kabisa. Ukiona hata mkitembea siku ya leo kule Kiambu County, mtaona ya kwamba hakuna madawa, kujaoshwa, hakuna patients, kwa sababu patients wa Kiambu wamejua ya kwamba hakuna madaktari. It has taken 127 days tangu madaktari waende on strike. County government hata reach out. Tumeona juzi the interns wamerudishwa kwa national government kwa sababu interns walikuwa wanakuja Kiambu County ndio wapatiwe madaktari wafundishe waone vile madaktari wanatibu wagonjwa. Lakini kwa sababu hakukuwa na madaktari au interns, wote wamerudishwa kwa national government. Tungetaka kusema ya kwamba hii maneno imeendelea for quite some times na governor hataki kusikiza. Hiyo damu yote iko mikononi mwake hao watoto na hao wazazi, kwa sababu yeye ndio amekataa kusikiza madaktari, yeye ndio amekataa kutafuta suluhu kwa hii jambo ama janga la mahospitali ya huko kwetu Kiambu County. Tunataka kusema kama wajumbe hapa, hatutanyamaza tena. Akiwa hiyo function ya health Kiambu government wameshindwa, wairudishie national government ndio kusiendelee, watu wetu wasiendelee kukufa na kuaga kwa sababu ya kukosa madaktari na madawa kule hospitalini. Hata ukienda not only the health facilities themselves, hata ukienda zile mortuaries ambao zinakaribia hizo mahospitali, mnuko unasikia ukiwa kwa umbali, kuna nuka vibaya sana. Na ndio nataka kusema siku ya leo tukiendelea hivi, na unajua population ya Kiambu is very high. Ukienda KU referral ama uende Kenyatta, watu wote wa Kiambu wamehamia referral, na wengine Kenyatta na wengine Murang'a. Na zamani tulikuwa tunajua ya kwamba Kiambu County ilikuwa ina serve Machakos pamoja na Northeastern pamoja na Murang'a na pamoja na Nairobi, lakini as we speak today hakuna facility hata moja inafanya kazi huko kwetu Kiambu County. Asanteni.